Hi everyone, welcome back to the channel. Today, we're diving into a serious condition that can affect anyone, especially those with underlying health problems, osteomyelitis. This is an important topic, so stick around as I cover what it is, who's at risk, how we diagnose it, and most importantly, how we treat it. Let's get started. Osteomyelitis is an infection of the bone. It can occur when bacteria or other organisms enter the bone through the bloodstream, from nearby infected tissue, or directly due to trauma or surgery. This leads to bone destruction, inflammation, and if left untreated, chronic complications or even amputation. Certain people are at a higher risk of developing osteomyelitis. These include diabetics, especially those with foot ulcers, people with poor circulation or peripheral vascular disease, IV drug users, those with recent bone surgery or trauma, immunocompromised individuals like those with HIV or on chemotherapy. Children are also at risk due to their developing immune systems, and it often affects their long bones, like the femur or tibia. Recognizing the signs of osteomyelitis early is crucial. Common symptoms include severe bone pain, fever, chills, and fatigue, swelling, redness, and warmth over the affected bone, and, in some cases, drainage from a wound near the infection site. To confirm osteomyelitis, we use several tests. Blood tests can show elevated white blood cells and inflammatory markers like C-reactive protein and ESR. For imaging, MRI is the go-to test because it detects early bone damage and abscess formation. But if we need more precision, a bone biopsy is the most specific test. It gives us a sample to identify the exact organism causing the infection. When it comes to treatment, the first line of defense is usually IV antibiotics. We typically start with vancomycin or ceftriaxone, depending on whether we suspect MRSA or other organisms. First line, vancomycin, 15 to 20 milligrams per kilogram every 8 to 12 hours, or ceftriaxone. Second line, once we have culture results, we can switch to something more specific like nafcillin or oxacillin for MSSA. Third line, oral antibiotics like clindamycin or levofloxacin are options after IV therapy if the patient improves. For acute cases, treatment lasts around 4 to 6 weeks, but for chronic osteomyelitis, it may require longer, sometimes even surgery to remove infected tissue. Osteomyelitis can occur in many parts of the body. In adults, it frequently affects the spine or vertebrae, while in children, it's more common in the long bones like the femur or tibia. In diabetics, the feet are especially vulnerable due to poor circulation and ulcers. So that's a quick overview of osteomyelitis, what it is, how it's diagnosed, and the steps we take to treat it. If you have more questions or want to learn about related topics, make sure to subscribe and leave a comment below. Thanks for watching, and see you in the next video.